Welcome. As our populations get older, figuring out how to provide really great, comprehensive care for our elders is becoming one of the most important things we can do. So today, we're going to dive into geriatric care through what's called a holistic lens, looking at the challenges, the incredible power of prevention, and the support systems that can make all the difference. This quote, it just gets right to the heart of it, doesn't it? The goal isn't just a longer life. It's a fuller one. One that's filled with dignity, with independence, and with a real sense of well-being. This simple idea is really the foundation for everything we're about to cover. Okay, so let's get into it. To provide care that actually works, we have to look beyond just the medical symptoms. We need a way to see the entire person in their own world. And that's where this comes in, the clinico-psychosocial model. It might sound a bit academic, but it's a really important idea that basically says you can't understand someone's health by only looking at their biology. You absolutely have to consider their mind and their world too. A great way to think about an elder's health is like a three-legged stool. You've got the clinical or biological leg, that's their physical health. Then there's the psychological leg, their mental well-being, their stress levels. And finally, the social leg, their family, their support system, their living conditions. If any one of those legs is shaky, the whole thing gets wobbly. They are completely and totally interconnected. So, let's see how this model helps us make sense of the real-world problems our elders face. What are some of the most common challenges that come with getting older?
Well, the source material points to a few big ones. Physically, of course, there's the natural decline in vision, hearing, and mobility, and many people are managing multiple chronic conditions at once, things like high blood pressure, diabetes, you name it. But look beyond the purely physical stuff, their functional status, just their ability to care for themselves, and these psychosocial issues are just as critical. Loneliness, for example, can be just as damaging to someone's health as any physical disease.
And I want to pause on that term functional status because it's measured using something called activities of daily living, or ADLs. This is a really big deal. It's the most practical way we have to measure how independent a person truly is in their everyday life. So when we talk about a decline in ADLs, this is what it really means. Struggling with something as basic as bathing or getting dressed isn't just a small problem. It represents a direct loss of autonomy, of freedom. Understanding these daily tasks is how we can figure out exactly where support is needed the most. But here's the thing, care isn't just about reacting to problems after they happen. The most effective approach is always proactive. So let's shift gears and talk about prevention and how we can promote health before issues become serious. The key here is all about empowerment. We're talking about simple but incredibly powerful strategies. Promoting good nutrition and safe exercise, making sure regular checkups happen to catch things early, and, so importantly, providing clear health education so elders and their families can make the best decisions. It's about shifting the entire mindset from sick care to well care. Now, these principles aren't just ideas floating around in a textbook. They are being applied in the real world through organized government programs, and our source material gives us a fantastic case study from India. So check this out. You can see how India's national programs tackle all three parts of that holistic model we talked about. For the clinical side, you have the NPCHE, the National Program for Healthcare of the Elderly. To manage those chronic conditions, there's the NPCDSCS, a program for preventing and controlling things like diabetes. And for that all-important social component, linking elders to pension schemes gives them vital financial support. This is a perfect example of a system designed to support the whole person, not just their symptoms. All right, so how do we pull all of these threads together? The clinical, the preventative, and the social. How do you combine them into a single effective strategy? Well, that's where the comprehensive management plan comes in. This is basically the roadmap. You start with clinical care for any immediate medical needs. Then you layer on those preventive strategies to maintain health. You have to address the mind and spirit with psychosocial support. You work to restore function through rehabilitation. And then you tie it all together by connecting the person to those larger support programs we just saw. It's a complete 360-degree approach to care. And really, at the end of the day, this is what it all boils down to. It's not about some one-size-fits-all solution. It's about using this comprehensive framework to create a personalized plan that truly honors the dignity and the unique needs of every single person. And that leaves us with a bigger question to think about, right? If we apply these ideas not just to one person at a time, but to our entire society, what would that look like? What changes do we need to make in our own communities to really support aging with dignity and with life? It's something for all of us to consider.